Good day, ladies and gentlemen. I'm here to discuss dentistry as a profession. I'm sure if you still haven't made up your mind to choose whether you want medicine or dentistry, Dr. Som has tried to sway you to go into medicine, but I'm here to try and pull your leg to come on our side. Why choose dentistry as your future? This time, ladies and gentlemen, more than ever, it is crucial to choose wisely. Reason being, technology is moving at a really fast pace. Very soon, there are professions that are going to be substituted by robots. And I suspect medicine is going to be one of them. You'll just go to a clinic, you'll get into a scan, the scan will just print something for you and tell you this is what is wrong with your body, and the next scan will print you, this is the prescription for you, then you move to pharmacy and you get that prescription. But with dentistry, 20 years down the line, your profession will still be relevant, so it's safe. This is an opportunity, grade 12s, to change lives. Choose the road less traveled. I know medicine is popular, everyone wants to be a doctor, but dentistry is a road less traveled, and it's worth it. What does it entail? If you are not sure whether you want to be a doctor or an engineer or an artist, dentistry gives you satisfaction to be all in one. It's all three under one umbrella. It's so exciting, it's so phenomenal, you are going to enjoy it. This is the general view. People think dentistry is just based on teeth. They think gold teeth, they think extraction, they think pain, they are anxious, they are scared, they think braces, that ugly looking face. That's what all they think about. But I need to assure you, there's more to us than this. The world of dentistry is full of beauty, excitement. You are going to enjoy it. We do more. We do implants. At the end result, you see a patient with a perfect smile. But underneath, we put in that screw, we place that, and we give you a perfect smile. This is one of the disciplines that we do in our curriculum. It's called oral and maxillofacial surgery. In this discipline, we deal with people who have fractures if you're involved in a motor vehicle accident. We know this face, this is Kanye West. He was also involved in an MVA. That was his face, that's how he looked like during the accident. And who sorted Kanye West out? It was us, not medical people. We also diagnose and treat pathologies of the head and neck. So it's not only medical people who know. In fact, if you go to a medical practitioner and you show them that you have a lump underneath your tongue, as in this picture, they wouldn't be in a position to assist you. It's us who will give you the solution. We also do this beautiful work, ladies and gentlemen. You come with your carious teeth, and we give you a perfect smile. Although dental disease is a preventable disease, but we try and assist you once you are in a bad state. We try and improve your confidence, your self-esteem, your psychosocial issues. This is one of the famous disciplines in dentistry, orthodontics, where we try and improve your jaws, your function, and your form. This is usually a very long procedure. It may take an average of a year to 2 years to see your results. So if you are not a patient person, you can't wait for 2 years to see results, then orthodontics may not be that niche for you. So you can choose oral and maxillofacial surgery for you, because the end result is soon. We deal with computers, everything, the software, the latest technology that we use to assist and treat you. These are ones of the scans that we use, CBCT scans, the X-rays, those are lateral cells that we use as our diagnostic tools on our daily basis. This is the CEREC, whereby you get into your dental surgery, you meet your patient, then the patient needs some new crowns. This we can construct there, and the patient goes out with a perfect smile. Isn't that fascinating? There's also research and academics. So initially, we used to, when someone extracts a tooth, then we'd give them false teeth. So we moved away from false teeth. We went into crowns and bridges. We went to implants. Now the technology is even more advanced. We are moving into stem cell therapy, whereby you can make your own new teeth. The frequently asked question people usually want to ask about the profession, the profile, the employment opportunities, the admission requirements, which have already been covered, as well as the working hours. The profession is ideally for both males and females. And it's also ideal for people who are family orientated. It gives you more time to interact with your family while making money in the process. I need to highlight to you, grade 12s, that there is a great need for this profession. There is a dire need for this profession. Not so long ago, the Minister of Health, in his budget speech, highlighted that they had done screening to some schools where they were assessing the physical barriers to learning of the school pupils. And I need to highlight to you that out of the 3.2 million school kids that they screened, their number one need was dentistry. And it was more than 10% of all the school kids that were identified that had dental needs. So there is a dire need for us out there. And if you look at our Health Professions Council register, ladies and gentlemen, I'm ashamed to say we only have 516 dental specialists and 9,676 dentists. And the numbers there, they don't tell us whether the people are practicing in the country or not. Because they might be here, they might be registered, but it doesn't mean the people are physically here. You may find that half the numbers people are practicing abroad. So those people are servicing 55 million of the SA population. We are not reaching out enough to our population. If I can tell you that in some of the clinical disciplines, our patients, there is a waiting list of about 5 years to access treatment. Need I say more? We live in a time where people are conscious about how they look. They are into selfies. In the morning, selfie. Tea time, selfie. Lunchtime, selfies. So people are conscious about how they look. So the more you are conscious about your look, the more you want to need access and get treatment. So the more you want to improve on the way you look. So the first person they will consult is the dentist. These are the personal attributes that you are looking for, because most of the time you are working independently by yourself, so you need to be a very focused and self-motivated individual, as well as on top of that, have empathy for the people. This is a people business, ladies and gentlemen. Every day you'll be encountered with your people in your profession. So we need people who interact well with the people. Communication, communication, communication. And the more you communicate with your patient and explain the treatment plans, the treatment objectives, as well as the costs involved with the treatment, the happier patients you are going to have. The admission requirements have been covered. The working hours are flexible. In private, you may need to work in public sector, you may need to work overtime, but in private, you work as per appointment, you do your appointment bookings. The job opportunities are really broad. You can work as a dentist in public or private sector, or as a dental specialist in one of the 6 disciplines that are highlighted there. If there's a name that you are identifying for the first time, I'm challenging you, ladies and gentlemen, to say, you've never heard of a periodontist in your area. So I'm challenging you to say, I want to be the first periodontist in my area. You can also work in the Oral Health Directorate. You can work at a national office or a provincial office. At this level, you are in a position to influence on the oral health policies. You can also work as a hospital CEO, a dean of school, or as a manager. You can be a lecturer, a researcher, or you can venture into medical law, doing your LLM in medical practice, as well as you can be a medical aid scheme advisor. I did qualify in 2003, and within my short span as a dentist, I have had the privilege of working as a clinical dentist, of working as a hospital CEO, as well as working for Health Professions Council as a regulator, whereby we go through different universities and accredit their clinical training programs. These are also the job opportunities that you are exposed to. You can work for dental companies who manufacture the materials that you use on a daily basis. Those are 3Ms and GlaxoSmithKline. The product that you are used to of GSK is the Aquafresh. So you can work for those companies or Colgate, as well as professional associations. Who wouldn't want to work in such a beautiful, inviting environment? You just get excited by going to work on a daily basis. This is a refreshing environment, and I'm sure grade 12 learners would love to have a future in such a beautiful place. So I urge you, ladies and gentlemen, when you go online, make the right choice. Choose dentistry. Thank you.